Hello, I'm Mike Wright, a practicing veterinarian since 1980. I am currently in practice in Orlando, Florida. Today I would like to talk about one of the most common orthopedic injuries in dogs, the cranial cruciate ligament injury, which is known as a CCL injury. This painful injury affects millions of dogs every year. Hundreds of thousands of the dogs who have a CCL injury every year have surgeries, and many of these dogs are not viable surgical candidates for several reasons. One, many of these dogs are geriatric and too old for surgical procedures. CCL surgery is an elective procedure, not a life-saving one. Number two, some of these dogs are not stable for anesthesia or for being in a surgical environment due to compelling medical issues such as heart disease, other organ dysfunction, or other medical problems. Three, dogs whose parent owners do not have the funds for surgery and the post-op rehab that is necessary. And number four, dogs whose parent owners are more interested in doing conservative management first and then consider surgery as a matter of final recourse. Surgery always has an amount of risk associated with it. In fact, over 35% of cruciate surgeries have serious complications. The complications involving CCL surgery in canines include the following. One is mortality and death. Two is infections. Three is actual failure of the procedure. And number four is subsequent injury to the opposite knee because of chronic offloading or stress placed on the uninjured leg while enduring the lengthy recovery period after surgery on the injured leg. The most common surgical procedures for canine cruciate injuries are TPLO, which stands for tibial plateau leveling osteotomy, and TTA, which stands for tibial tuberosity advancement. Both of these procedures are major surgeries which involve cutting bone and altering the geometry of your dog's knee. The risk and complications of these surgeries are considerable, including bone cancer from metal implants, screws coming undone from the bones, infection, and other medical problems. A good resource for learning the facts about cruciate surgeries is the surgery facts page at PoshDogKneeBrace.com. The information is gathered from veterinary resources across the web. There are viable alternatives to surgery which I believe should be considered or pursued before any CCL surgery is undertaken. One of these alternatives is conservative management using good nutrition, whole food supplements, some herbals, some homeopathics, along with the use of an orthopedic dog knee brace to provide stability for the knee. As a veterinarian, I believe in the precept of first, do no harm. Therefore, I believe in protocols that are conservative. This includes the use of bracing to provide stability to the injured knee well before I would recommend surgical intervention. The fact is that most dogs do quite well with conservative management and bracing, so it is only logical that surgery be done only as a matter of last resort. Delaying surgery with conservative management and bracing does not diminish any successful outcome of surgery, nor does a brace cause any arthritis. A brace causes no pain and does not cause any of the serious complications that arise with anesthesia and surgery. Furthermore, with a Posh dog knee brace, your dog can continue to exercise and begin to recover from the first day versus 6 to 12 weeks of pain and recovery with surgery. However, if surgery does become necessary, wearing a brace like the Posh dog knee brace provides protection for the leg post-operatively and can greatly diminish the chance of a bilateral injury. That is, any damage to the good leg during the lengthy recovery period by minimizing offloading of weight onto the good leg. In other words, wearing a brace after surgery will allow your dog to bear weight on the surgical leg as opposed to the transferring the weight onto the uninjured leg. As a veterinarian, I have referred numerous patients to Posh Dog Knee Brace for conservative recovery from CCL injuries. This company has been extremely responsive to each of my patients. Their stifle brace is the most advanced product out there. They alone have eliminated the need for casting. I like their use of micro buckles, ladder straps, and rust-proof parts. What I like most about the PoshDog knee brace is that it's truly built better than any other stifle brace on the market. Their custom flexible brace shells are very comfortable for the dogs as opposed to the rigid hard braces out there. The PoshDog knee brace design actively suppresses the tibial thrust and allows for recovery of the injured leg. Clients get great results only having the brace on their dog for up to 3 hours a day during exercise. Again, I recommend conservative management and bracing with a PoshDog knee brace well before pursuing the radical approach of surgical intervention.